The tibialis anterior. Starts here laterally on the tibia, right below the knee, travels down, crosses over the tibia, attaches to the inside of the foot. Now anatomically, it does dorsiflexion and inversion. But functionally, it does a lot more. Because it's a dorsiflexor, it's going to help us clear our toes when we step over objects or go up and down stairs. But it also eccentrically controls plantar flexion, making it a very important muscle for deceleration and jumping. Does everyone need to train the TA? No. Here's the type of people I would recommend it for though. Number one, you lack ankle or knee stability. The TA is important in both of those. Number two, you're looking to improve those sport-specific movements, deceleration and jumping. I would add some type of TA training. Number three, you're someone who is susceptible to shin splints and or stress fractures. The TA plays a role in those pathologies. I would look at your TA strength and see if it's something that you need to work on. And obviously, number four, if you just like big legs, the TA is important in obtaining that look. So if you want legs that look like this, let's get the toe raising. A lot of gyms nowadays have tib bars, which is a specialty bar specifically for doing these tib raises. Now don't worry if you don't have access to a tib bar, although they're nice, you don't need one. So the first exercise is just a standing tib raise. So you're gonna go back flat against the wall. Start feet maybe a foot away from the wall, and all we're doing here is just bringing toes up nice and slow and controlled, and toes down. And really, that's all it is. Toes up, toes down. Now, to make it easier, you're gonna go closer to the wall with the caveat, you're gonna have less range of motion. So when you're closer, your foot's already in a dorsiflex position, leaving less room to dorsiflex even further. Although it does make the exercise easier. So if this is too easy, you slide out. Now our foot's in a more plantar flex position, which gives us more room to dorsiflex into. And to make it a little bit harder, you can go out even further. Still nice, slow, and controlled. And you should feel that right on the shin. But dose this like you would any other exercise. So if you're training for strength, stick to that 5 to 8 range, which means this exercise may be too easy for you, which is where the next exercise comes into play. So you need some weight for your tib raises. The seated version, the great thing about it is you can really use whatever you have. So dumbbell, kettlebell, plate, all work really well. Same exercise, so it's still toes straight up, straight down. And the same concept applies. We want to make sure we're getting a nice full range of dorsiflexion. So don't have foot too close, or else you're just locking yourself to a small range. So if you have a dumbbell, you can place it right on the foot. A little bit of a balancing act, but once it's there, exercise is still the same. Straight up, little hold, slow and controlled down. Straight up, slow and controlled down. If you don't have dumbbells, but you have a kettlebell, same idea. A little easier because you could just hook it around the foot, kick that leg out, straight up, straight down. Works the same way for a seated heel raise. I'm sorry, a seated toe raise. And if you don't have a kettlebell or a dumbbell, but you have a plate, that will also work. It kind of stabilizes itself a little bit, which makes it a little easier. Straight up, straight down. As long as you're feeling it in front of the shin, you're doing it right. Don't forget to do both sides. Another way you can do this at home is with a band. So make sure your band is anchored to a squat rack, in a door frame, whatever you want to anchor it to, just make sure the band's not going anywhere. On a bench, on a bed, we are just looping that band in the same place that dumbbell was. And from here, it's the same exercise. Toes up, toes down. Still slow and controlled. If your preference here is to have a little bend in the knee, that is totally fine. I might have to change the anchor of my band, but since the tibialis anterior does not cross the knee joint, you're accomplishing the same thing with knee bent or knee straight. And if you don't like the band, use a kettlebell. Same thing. Loop it around. And you can get that full range this way. Or this way. All really good exercises you can do at home with minimal equipment. I'm burning now.